Today there is a podcast going on. That is Dr. Krishnamurthy sir, 26 plus years of experience. He has conferred national award.
We were having only 2000 rupees by the time. I was not a very bright student also. People were running behind the mixopathy or allopathy. Beshaja, Besham Roga Bhayam Jayati iti Beshajam. And my journey in Ayurveda.
Today there is a podcast going on. Not an interview actually. You are going to really enjoy this podcast, and I hope you all enjoy. So welcome to the podcast, The Tale of a VAIDYA. That is, we'll know about his journey and his struggles throughout his career. Next. So here is a quick insight today for our today's chief guest or guest, that is Dr. Krishnamurthy sir. As you all know, he is well-known practitioner, and also he has 20 plus years of experience he has. Then he is well-known for his treatment in rheumatoid arthritis, infertility and psychosomatic disorders. And next. He has pursued his PG studies from renowned college, that is Jamnagar, Etra. As you all people know, it is very a renowned college. Then he has stood second in his UG studies and first in PG studies to nation, or that is India. He has conferred national award for his research work on critical analysis of folklore medicines used in South Canada. Then he has guided more than 30 plus PG students. And as you all know, the Spark research also is guided by him. Our class Mandara has done the research. No? Then more than 75 articles have been published on his name, and many more such achievements are there, which I couldn't concise all those things into a slideshow. I invite Dr. Krishnamurthy sir for this interview. Thank you. So let's begin this podcast with the main title, that is Practitioner's Journey. First we'll listen to his journey, then we'll move on to his current practice and all. Okay, first, how did you get into this field of Ayurveda, sir?
First of all, thanks for the opportunity for inviting me to explore my thinking and my journey in Ayurveda. As you have asked how I came to Ayurveda. Till my PUC, I was not having any orientation towards any of the profession, because being a student of a rural area, and we were not in a position to go for any higher level of education, because by the time itself capitation was started. Ayurveda had a capitation fee of about 40 to 50,000 rupees. MBBS was having 15 to 20 lakh rupees, and that was the scenario. And I was not a very bright student also. So I used to manage my farm, means agriculture, followed by rest of my interest, because from the beginning I was having good interest towards poems, short stories, literatures, and I was doing Harikatha, all these things. But immediately after my PUC, I had a time period of about 1.5 to 2 months. By the time I used to go near a traditional healer in my village, Billam Padavu, where they used to heal through the medicines, traditional medicines. For my interest, when I was in 7th standard, when the study desk fall onto my leg and it was totally broken. By the time with the same healer, it was united, and I never took even Ayurvedic medicine or allopathic medicine. That probably inclined me to go towards Ayurveda, followed by another Panaje traditional healers. There also I used to go. Probably all these things have made me to come to Ayurveda.
Okay, sir, it was very innovative and also interesting part of your journey. Who or what inspired you to pursue Ayurveda as a career?
As I told, actually I got the last government seat in Government Ayurveda Medical College, Mysore. But in the last moment, they have converted that last seat into a category for girls. That was the time period. That is why I missed that last seat, and my rank fall to the government seat in private college. That is why I opted Koppa College. There also, when I went along with my father, they have asked me the fees, followed by college fee of about 5,800 rupees. We were having only 2,000 rupees by the time in my hand. The principal of that college was also known to us. He was from our place only, and by the time, because that arrangement of another 3,000 was also not in our hand. That is why my father told, probably I feel that my son is not having the option to study in this college, we will go back. But when we went to the nearby the bus stand, and by the time my father recollected, one of our well-wisher told, anytime, whenever this person is going for any course, we will help. With the faith, because I want to name, because actually we have never taken the monetary benefit from him. His name is from my place, Ishwara Bhatt, from my place. And but we have never taken any help from him. But he assured, in any point of time, if my help is needed, I will assure, I will give. Only with that faith, I came to Ayurveda, and I was not having any great influence towards learning Ayurveda. Probably I used to go to the folk healers, they have indirectly had the influence over me. But studying and achieving greater things in Ayurveda, so many people are there. And first of all, when I was studying in Koppa, one Kokre Ganesh Rao was there. He was a well-known Nadi Vaidya, and I had a great opportunity to talk, remain there and study. Thereafter, so many people like Nechil Shashikumar during internship, PMS Rabindranath in Kerala, and moreover there another person, Trivenkatachala Nambudri, and who used to teach Nadi Vidya followed by Ayurveda from Kanjangad. And all these people have made me to opt purely Ayurveda in my practice, because by the time majority of the people were running behind the mixopathy or allopathy. That made me to peep towards pure Ayurveda. Once after reaching to Jamnagar, it was a big story, and I was the first person who pursued my PG in Jamnagar, and there we had a great influencers like Dr. P.S.N. Bhatt, Dr. M.U. Bahadur, Madhava Shastri, so many people were there. Ultimately, it made me to practice pure Ayurveda. That is how I am, since about 25 years, I am practicing pure Ayurveda.
Could you share your education and professional journey in Ayurveda?
Yes, till PUC I have studied in Satya Sai Education Institution, Alike, in my native itself. Thereafter, as I told, I pursued my BMS in Koppa Ayurveda Medical College, and MD in 1998 I have completed my UG. Thereafter, in 2002 I have completed my PG in Gujarat Ayurveda University IPGT and R, Jamnagar, in the subject Rashastra and Vaishya Kalpana. That is about my education.
As you told, there was the turning point during the folklore practitioner. You got into Ayurveda field, interest in Ayurveda field. But was there any other turning point or memorable moment that shaped your practice?
Yes. During my BAMS time in second year, I myself suffered from typhoid and as well as obstructive jaundice. By the time, my own teachers couldn't help me, because majority of the teachers who were there, who were teaching, they were practicing allopathy only, or rarely mixopathy they never used to practice Ayurveda. That is the reason why we were not having any reliable model to adopt. But because of helplessness of my own teachers to treat my typhoid as well as jaundice, made me to come to my native. By the time, in both the context of my typhoid as well as obstructive jaundice. It was very severe condition. I was not in a position to wake up also, and many have guided me to take Ayurvedic medicine, sometimes some allopathic medicines, but I have taken some medicines from allopathy for a period of 1 week, but was not having any response. That is why in Ukkinadka, Sahasraksha Vaidyashala is there. Now Ukkinadka's the hospital is there. There Ukkinadka Vaidya was there, was having the earlier BAMS degree, JAMS degree, and he treated me successfully in both the context, only with the Ayurvedic treatment, and that increased my confidence. Probably even today while I am practicing, I am adopting majority of the formulations what he used to practice, because it has given me a great impact, especially the Ukkinadka Sahasraksha Vaidyashalas and Panaje Venkatramana Daitotas. Their contribution is more, apart from Tiruvenkatachala Nambudiri and PMS Rabindranath.
So let's move into principles and philosophy which he uses in clinical practice. What is your core philosophy regarding healthcare and healing in Ayurveda, sir?
I am a purely Ayurvedic practitioner, but I am having equal faith with the allopathy, homeopathy, naturopathy, or other modes of treatment like pranic healing is there, Reiki is there, Janman remedies are there, so many other varieties of treatments are there. I am having equal faith, because treatment is reaching to a destiny. Going to Mangalore, we can go by auto, we can go by bike, we can go by train, we can go by flight. Various approaches are there. What is suitable for the day, for the time, for the person, that is what we have to think. And it was my choice, because being a master and a PhD holder in Ayurveda, if I am practicing with allopathy, there is no any meaning. And moreover, I am very happy and confident about my science as well as my way of practice. In my practice, I take much time for the case taking. Minimum, in case of chronic cases, I take 30 to 35 minutes. Otherwise, minimum 20 minutes time I take. Even any case of even simple problem like toothache or earache, headache, whatever it may, minimum 15 to 20 minutes time I take, and I will deduce the classical approach, means dosha predominance or dosha which is affected, dhatu which is affected, srotas which is affected, organ which is affected, and thereafter I am thinking of the drugs what can be opted, and thereafter I am thinking the formulation which is suitable or the therapy which is suitable. And majority of the cases I treat the cases 30 to 40% of the, if any day if I see 50 patients, I am getting 50 patients, only 25 to 30 patients I see. Rest of the cases I either refer. 15 to 20% day cases, now I am practicing only on Sundays. Every Sunday I refer 15 to 20% cases to others. Only 45 to 50% cases, 50% we can say cases I see. Rest of the cases I ask them not to take medicine, continue with the lifestyle changes. And very rarely I ask them to go for homeopathy, allopathy, or because already if they are taking some medicine already and they are getting good result. I never turn towards Ayurveda, because when they are finding some benefit out of any one science or one medicine, better not to shift to our science, because my intention is not to make a person as my client purposefully for the sake of money or for my consideration. That is how I treat the cases. So my approach, in that also I believe, whenever I take 10 cases, we say if even 7 to 8 cases are cured, I believe that medicine is curing only 3 to 4 patients, and rest of the things, it is because of either their food, the lifestyle changes, maybe alteration in the food habit, lifestyle, sleep pattern, the way of taking food, way of their exercise, all these are having great impact. That is why out of 50 patients, if I take only 25 patients as my clients, and among them if I treat all the cases of 25 cases, if 20 to 22 patients are getting benefit, really my medicine is working only in 10 to 15 patients. In rest of the cases, lifestyle changes, whatever the modifications we are, that is what we are working. Ultimately we can say, but everywhere we are having Ayurvedic background. Even while asking the patient to, I am refer somebody for their problem, I have an Ayurvedic background, because what I feel that asadhya vyadhi in Ayurveda I never try, because my clinic is not a trial place. So whenever I feel that in Ayurveda, if it is told as asadhya, I never, because it may be sadhya in other science, maybe allopathy, homeopathy, because I have seen which are never impossible to treat or are successfully treated by homeopathy, successfully treated by in some Unani practices, or surely many more diseases are there which are treated successfully in allopathic medicine. But I am not a master, I am not a confident person in allopathy, that is why I am asking them to, or I am referring to somebody else. That is how. But surely we need to consider sadhya vyadhi, asadhya vyadhi, or yapya or anupavkrama. Based upon that, we need to adopt the treatments.
Thank you, sir, for your insight on practice. Which Ayurvedic principles do you feel are most important in your practice?
Usually Shodhana, Shamana, or sometimes Rasayana, all these are coming to our mind. But in my context, every disease I consider 2 points. One is dosha bala vruddhi, dosha bala pradurbhava, and dhatu bala heenata. That is my concept. Which dhatu bala heenata in the individual and which dosha bala vruddhi. Even today morning I got a patient from a phone call, and she was from my native, about 45 to 50 years old, and she is to tell that I am having severe headache with the blurring of the eyes. So that immediately we need to think, what is the dosha bala vruddhi? Surely it is vata pitta vruddhi, and dhatu bala kshaya. Which dhatu is got kshaya? In that case, rasa, mamsa, majja dhatu kshaya was there. Accordingly, the treatment changes. Other than that, shodhana, shamana, surely they are to be considered, but that is how, because whenever dosha, if we increase the dhatu bala, we will be getting enough strength to bear the pain. That is very important. When a person is suffering from a disease, apart from curing a disease, if we increase the dhatu bala, ability to sustain, ability to withstand the disease, that itself is a treatment, because that will be a permanent treatment. And if we are treating the dosha, we are treating only the person which is the external entity, which has increased very recently. That is why in every case, even the treatment, in the prevention also, preventing from the external element is very difficult, whereas internal substance is very good. That is why every time dhatu bala vruddhi should be maintained. If dhatu bala vruddhi is there, the attack by the doshas, it may be abhyantara or bahya, dosha prakopa karanas, that can be withstand, that can be sustained. That is the line of treatment.
How do you integrate Ayurvedic concepts in daily patient care?
Already I have told how dhatu bala vruddhi and dosha bala kshaya are taken care. Apart from that, always I educate regarding the routines. Na vegan na dharit, that concept I highlight, because where I used to practice as a traditional in Panaje, Vaidya Pandit or Billampado, or in Kerala, Thiruvenkatachala Nambudri, their thought was also only 50% focused towards medicine. Rest of the things are, we having the concept of patya and the avega dharana, and all these concepts are taken into consideration. And moreover, apart from the medicine, even the aushadha sevana kalas, dose, vehicle, these are also having greater role in the treatment. So even a best medicine, the first of all the concept of what is the best medicine is very difficult to define. Whether a costly medicine, a medicine which is having multiple ingredient, a medicine which is given larger dose, medicine which is costly, or medicine only a rasa aushadha, they are the best. Or sometimes mere triphala churna is working in an excellent way, which is not, its result is we are not getting even if we are giving a bigger kashaya or a tablet. That is how I treat the cases.
In your view, what distinguishes Ayurveda from modern medicine? That is, how hatke is Ayurveda from modern?
I have equal respect to every science, every known or unknown science, because It doesn't mean that only allopathy is there, homeopathy is there. Several other systems of medicines are also like Tibbi medicine is there, Siddha medicines are there. I have equal respect. The reason is each and every speciality or a healthcare system is having its own advantages. But with respect to Ayurveda, it is treating the body, individual's body as a unique entity. Usually we have studied that the disease which is manifested to me, or a jaundice or a fever, or what we call even a modern in science we say typhoid or malaria, which is causing me or somebody else, it is not we are not following the universal treatment protocols. The disease is taken into consideration, but the disease is emphasized much. That is why more than the rogi is taken into consideration. We are treating the rogi as such. But we are rogi pariksha and roga pariksha, both are taken into consideration. But much emphasis is given for the rogi, because even a small headache cannot be withstood or cannot bear by an individual who are having avarasattva or who is having lower body configuration. Whereas severe fever, 103, 104, with that also they are going for work, they do their daily chores. It shows that disease is the entity which should be controlled by the people. But in few of the diseases it is not so, and we need to take focus on, as an Atyika, we need to focus on the disease itself.
Let's move into current practice of Dr. Krishnamurthy sir. So what type of diseases or conditions do you treat most often, sir?
The answer is the diseases which are seen most often. Means when we were studying, it is told we had a great teachers like M.S. Baghel, H.M. Chandola, B.M. Nirmal, Madhusudana Shastri, C.P. Shukla, so many teachers, good teachers, great teachers. They used to tell us that never think of a rare disease. Think of a common disease when the patients are approaching you. That is quite true also, because I am practicing in a very rural area where even though I am not a family physician, immediately when the disease, when they are getting some discomfort, they approach. Or else they will move around. First priority is people around me will come for their simple illness, or else the diagnosed cases are coming. Means they will move around, maybe in my village, in my taluk, in my district, sometimes from the state, because I am staying in Karnataka, Kerala border, which the cases which have travelled for 20 to 30 physicians, they are approaching me for the treatment. By the time, usually they are treated by the physicians or surgeons, super specialties of higher profile. But with the helpless mode, they are approaching me. That is why I think whether it can be cured through my science, and because many time the diseases can be cured through the science, our speciality. But I am thinking myself whether I am confident regarding that, because I am available only once in a week in my clinic. Some diseases can be treated only as an IPD. On OPD basis we can't treat, and if we are treating, they will be helpless. Only because I am not ready to sacrifice their life for the sake of Ayurveda. Ultimately everybody is in need of good health. It may be any science, it may be Ayurveda, it may be allopathy, it may be any other, even Daiva Vyapashata, it may be. Ultimately they should be happy, they should be pleasureful, they should be confident, they should live with the disease sometimes. Surely it is cure of the disease, but they should withstand with the disease. With that intention, I never compel them to take only Ayurvedic medicine.
Which Ayurvedic treatment or therapies do you commonly use?
It depends upon the kind of disease as well as patients. In my clinical practice, my prescriptions are only Shamana Aushadas, but some of the medicines I prescribe for the Shodhana purpose. I am not having a Panchakarma setup, and wherever Panchakarma is needed, I recommend. That is why I refer the cases to Ayurvedic physician itself. Nearby my area, for 5 to 6 good treatment centers are there, I refer them. If at all I am treating a case, in most of the cases I prescribe Shamana Aushadas, but before that some mild Shodhana medicaments I am advising. Maybe it is for relaxation purpose, diuretic purpose, etc. I myself confident in treating the headache conditions, varieties of headache conditions, and varieties of the gut disorders, maybe gastroesophageal reflux disease, because I take the help of the modern terminologies, because it is very easy to convince the patients, because our terminology, because kapha pitta, adhika amla pitta, such words are very difficult to understand, because GERD, duodenitis, ileitis, they will understand very easily. Even though I know that being a purely Ayurvedic clinician, we should emphasize Ayurvedic words, but that is why my purpose is not to show my wisdom or my knowledge. Instead, they should understand what is going on in their body. That is why I convince in their language, or the language in which they will be appealed more. And gust is especially because in my PhD study I have taken Takrarishta as my thesis topic. That is why I have treated more than 350 to 400 patients who had a chronic gut suffering. Chronic gut suffering, ultimately they mimic all the features of Grahani. That is why I am very confident in treating such diseases. And apart from that, the conditions where neurological deficits are there, these diseases also I am treating. And majority of the cases I treat the diseases with easily available, quite economic medicines, that too 2 or 3 medicines only. I never prescribed 4th medicine in my 25 years of clinical practice. I never prescribed 4th medicine. Even a person may be having 5 to 8 symptoms. 5 to 8 symptoms like migraine headache, indigestion, loose motion, some other issues, stomatitis. I take the help of only 2 to 3 medicines altogether. But I prescribe it at most dose. Even a chronic diabetes patient comes who is having the blood sugar range 250 like that, random blood sugar, I treat. But I will see whether they will be obeying or not. In that case, I prescribe only 2 medicines or the maximum 3 medicines. Whereas nowadays, earlier also, people prescribe the medicines depending upon their prescription letter. If a bigger prescription letter is there, 8 to 10 prescriptions will be there. 1 kashaya, 2 churna, 1 lehya, 1 taila, 1 gruta. No, I have practiced strictly, because I am thinking whether that medicine, if that prescription is given to me, whether I can take. If I can take the prescription, I write. Otherwise, I never write the long prescriptions. Only 2 to 3 medicines maximum. If any mandate conditions, 4th as an application I may give. That too very rarely. Otherwise, 2 medicines, 1 applications likewise.
Do you incorporate Daiva Vipashraya and Sattva Vajaya Chikitsa in your practice?
Surely, second part is mandate for every case. Sattva Vajaya Chikitsa. Ahitebhyo Ardebhyo Mano Nigraha. Because my speciality is Bhaishaja Kalpana, where Bhesham Roga Bhayam Jayati iti Bheshajam. So, if we build confidence among the patients, it itself cures 30 to 40% of their illness. That is why Sattva Vajaya means I will try to build the confidence by assurance, by convincing, by quoting the incidences, what is going on around, and how the disease is affected, how it is very easy to treat the condition. Problem is, many a time patients are not knowing about their disease. Whenever a nomenclature is given, nowadays they search in the internet, and internet, ChatGPT, whatever, it is giving the details regarding the disease. But how the person he is, that information is not given. That is why assurance is very important. Even if our medicines are best, and if we are not building the confidence in the minds of the patient or patient's party, sometimes our effort will be waste. That is why before prescription, during the case taking itself, I will see whether the patients are happy in my presence. If I feel that patients are not confident with me, or not friendly with me, or patients are not ready to accept my medicines, patients seek something else. Sometimes what happens, they approach seeking Ayurvedic medicines, they are telling, sir, doctor, don't prescribe me leha, don't prescribe me tablet, don't prescribe me churna, don't prescribe me kashaya. Everything is there in their mouth. By the time I think I will tell, at the end of 20 to 30 minutes of talk, I will easily convince that I am not the suitable person to treat and you can approach somebody else. Because taking the medicine prescription fee or medicine charge for a period of 1 week or 2 weeks, ultimately we will ruin. Means at the end, after 2 weeks, after 3 weeks, surely they will be telling this person is not suitable for me. And my credibility is also lost, and the credibility of the science, Ayurveda, is also lost. That is why I am not ready to do such things with the patient, because nowadays it is going on, increasing the number of patients. I am not having that from the beginning itself. I am not having. Even sometimes I have seen only 3 to 4 cases initially. Initial 2 or 3 years, every week I used to see 3 to 5 patients. But I never tried to increase the number of patients, because ultimately that patient may be a family's person is coming to me, means one day even I may have to go, or my family people may go and approach somebody else. If the same scenario comes, the bad way we are feeling. That is the reason I never make the patients, I never cook the clients to make as my patients. Majority of the cases I convince that your disease is not a big problem. By that itself 50 to 60% their illness is reduced. Thereafter I prescribe common prescriptions. That is why regarding Sattvavajaya much emphasis is given. Then Daiva Vyapashaya, yes. In the cases like infertility, in the cases some psychological disorders, psychosomatic diseases, and in some diseases where disease is not getting benefit by any of the system, they approach Ayurveda, homeopathy, naturopathy, so many systems, and they are approaching towards Ayurveda, sometimes some skin diseases. And by the time I assess whether they are having faith with the deity, faith with the god, goddess, or it may be any Hindu, Muslim, Christian, Jain, whoever it may be, I assess, and accordingly I suggest. If Christians are coming, I am in my area itself, I ask them to go to Attur church or the church of their area. I will ask them to play some charity work. Or if they are Muslims, in my area, Kumbol is there and Kura Tangal is there. I refer them. I ask them to go and approach, seek their blessings. Or likewise. So by that their confidence is increased. Apart from that, and second thing is, I ask them to approach those people who are not costly, means who are affordable, who give the best suggestions. Sometimes bigger homa, bigger havana, that cost of that itself 30,000-40,000 rupees. And patients are coming to us by chronic suffering, by seeing all the specialists, super specialists, etc. And as an ultimate area they are coming. If once again we are asking them for such things, or sometimes huge charity was donation of gold, all these, the silver, etc., that they can't do. Ultimately, the faith followed by the confidence, if they are combined together, good result we can get. That is why, especially in infertility, skin disease, psychosomatic diseases, some kind of neurological deficits, neurological problems also, I ask them to approach for the Daiva Vyapashaya. But none of the Daiva Vyapashaya I myself do. It is a very strong area in, I have translated Basavarajiam book. The 25th chapter, Karma Vipaka is there. Various karmas, how they will be acting as a disease, it is explained well. That is why I am having very good confidence over it. But I am not a mastery in that Daiva Vyapashaya Chikitsa. That is why I refer the people who are, regarding whom they are having confidence.
Can you suggest any nearby people whom you know, so that you will refer to them?
It is, see, I never refer only because I see their mindset. For example, skin disease is there. If it is treatable through Ayurveda, I give medicine. If I am confident that it can be treated through homeopathy, usually in homeopathy system, in lesser duration, more effective medicines are there. Sometimes I say it is better than Ayurveda, homeopathic medicines are there. Because if we have to give the medicine for 6 months, the amount of time as well as amount of the money what they have to spend with the lesser day, within a period of 20-25 days, and with the within 1000 1500 rupees, if they can be treated, I am not having the stubbornness that I will treat only with the Ayurveda. Ultimately, patient should be happy. That is why I refer to homeopathic people. Or some of the conditions, if I feel that it cannot be treated by Ayurveda or homeopathy, I directly refer to allopathy. Whereas some people, they are having a dilemma that whether Ayurveda can be combined with some Daiva Vipashaya Chikitsa, etc. I will deduce by their conversation according to their refer. For example, in skin disease, if is there, what complaint is there? Mujungavu temple is there. There is a practice of offering horse gram, huruli, horse gram. Likewise, so many other things are there, offering some illness, mental disorders are there. In that case, some Pashana Murtis are there, some nearby places. I ask them to go and offer. And in some infertility cases, I ask them to go to Subramanya, or sometimes if they, I will deduce from their mouth itself. I will not usually, they will ask, so I will, who is your deity? Aradhya Deva or Kula Deva. I will ask, and accordingly I will suggest, because that will be more beneficial, and otherwise they have to spend much on these rituals, Homa, Havana, Prayashchitta, Upavasa, etc., which is not practical. What is practical, what is feasible, if we adopt, they are also benefited, and the guilty conscience will not, we will not get.
Patient consultation and diagnosis in your practice.
Yes, many a time many interns who are coming to my clinic, they are also having this question: what is the diagnosis? Actually, every physician should diagnose the case before the treatment. But I too diagnose the case not by naming the disease. I name with two perspectives: which dosha is affected, which lesion is affected. That is my diagnosis. I never give the name, just like Suptata, Suptavata. So whether is we are having 7 layers of skin. Which layer is affected, which dosha is affected. Accordingly, I am giving them a prescription. So, for example, Lohita skin layer is affected and Pitta is affected. My line of treatment will be always the Manishta, Sariva, or if it is Kapha, Avarodha is there, Bakuchi I may give. Likewise, I am giving the medicine. For example, Suptavata is there, Saptamrata Loha along with Paripata Adhikada. This is how I am treating. I never name the disease. Nai sarva vikaranam namato asti dhruvastitihi. So, for me, naming of a disease is not important. Diagnosis is important. But my diagnosis is not giving the name for the disease. Instead of that, which is the dosha predominance, which organ or which srotas is affected. That is the way how I diagnose the case. Even in my case sheet also, I will write the pulse diagnosis. It is not in a very subtle level according to, because I have studied in Trivenkatachala Nambudiri. What is the knowledge, knowledge I have got? The Taratama Bhava, accordingly I write what is the dosha predominance in the first visit, and what is the dhatu affected, what is the organ affected. Apart from that, modern, say nowadays it is a mandate, because while referring the case etc., it will be helpful. That is why rest of the things, maybe the blood profiles or any investigation, that I record in my case sheets.
Which is the most common disease you treat effectively from Rasaushadhis, and which is the Rasaushadhi which is safe to use?
I treat the common diseases. I am not a specialist in the treatment of so-called grave diseases. Usually skin disease and arthritis, some neurological problems, neuralgia, myalgia, associated conditions are the strong areas. Probably it depends upon the individual's interest, followed by the recognition of myself in the society. It made me to, as such, because I am a non-clinical person. And academically, I am a non-clinical person. But since from the beginning, I used to treat all these irritable bowel syndrome diseases, some varieties of skin diseases, etc. That is why they are by strong areas. People, I see more of these patients. And you have asked what are your Rasashastric prescriptions. Even though I am a teacher of Rasashastra, only in the very, very essential cases I treat Rasaushadhas, unique Rasaushadhas. Otherwise, my prescription will be Kamaduga and Kamaduga with Mauktika. my common prescription, and in my clinical practice, all these 25 years, I have practiced only with the maximum 25 medicines. Very rarely, because of the compulsion, because of unavoidable circumstances, or because of the far-sighted patients, etc., ready-made prescriptions I have given. Otherwise, now for the day, any medicine which is costing less than 2 rupees, maybe it is sometimes only 10 to 15 paisa medicines also, I usually prescribe. And my prescriptions, already 2 to 3 prescriptions, one kashaya will be there, 1 or 2 tablets will be there, or 1 kashaya, 1 churna, 1 tablet will be there. And quite interestingly, sometimes single medicine I will give in 3 forms also for the patient satisfaction. For example, recently it is a trend, diabetic patients are more, and borderline patients can be managed through patyas. Otherwise, I ask one company Chandra Prabhavati, which is round in shape, another company Chandra Prabha, which is black, flat in shape, and another tablet Chandra Prabha, say powder is also available. Only one medicine I am giving, but patients are thinking that, oh, doctor has given 3 medicines. So that is because that is the ultimate medicine what is required. When we are giving 3 to 4 medicines, what it is doing at the end of the day, nobody knows. Because even though we are telling that drug is acting in this way, rasa, guna, virya, vipaka, etc., ultimately how it does, nobody knows. Just like a surgeon who is saying, I have done the surgery, God heals it. We are dosha, dushya, samurchana, vivechana, etc. done. The medicine is prescribed as a arsha vachana, and it is working. Giving explanation is very difficult. However, the simple medicines are my prescriptions. I can tell what are my common prescriptions, if you are not having that question. GI disorders, my favorite medicine is Dhanvantara Gulika or Vayu Gulika. In 30 to 40% patients, if it is the disease is because of the GI tract related directly, Dhanvantara Gulika is my first prescription. And other than that, depending on the dosha predominance, pitta predominant conditions, Kamaduga with the Mautika, Sutashekara rasa with the gold I prescribe in very rare cases. Not every case I am prescribing Sutashekara rasa with gold, but it needs, because nowadays people are coming with all kinds of modern medicines. When they are approaching towards Ayurveda, usually our medicines will not work sometimes. Or Pravada Pishti, it is my common Pravada Pishti, Godanti Basma, Paripata Adikada. Then Arjuna Arishta, Sarivadya Sava, Mahamanjishtadi Kashaya, Maharasnadi Kada, Chandra Prabhavati, then Trifala Gugulu, Kaishora Gugulu, then Shirashuladi Vajrarasa, and Lehas, yes, Chavana Prasha, Kushmana Rasayana, Shatavari Lehya, Amalaka Rasayana, Asanadi Gana Kashaya. All these are my usual prescriptions. Since about 7 to 8 years, I have started giving some patent proprietary products also. You may ask, when enough classical preparations are there, why you to started prescribing the proprietary products? Sometimes because of the non-availability, because majority of the patients who are approaching me are from far. They can't often come to my clinic. Being in distance, I need to give the medicine. For example, today also I have prescribed for the case Shirashuladi Vajrarasa, where 20 bottles are needed for a week. But we are not getting a container of 20 medicines. There will be a container of 100 tablets. So if they buy that 100 tablets container, it costs about 350 rupees. Instead of that, which is about 20, Ulcer-X tablet is there, for example, it is 20 to 30 tablets available, or some strip tablets are available. By the time, for the patient's feasibility, because ultimately I am not thinking of how much medicine I am prescribing, and it should be only with the Ayurveda. Yes, it should be only with the Ayurveda if I am prescribing, but moreover, it should be affordable, it should be economic. That is why sometimes I may prescribe the proprietary products. But Rasasastric medicines, earlier I used to prescribe because I used to mix the medicines. Like for example, the Suktavata conditions, a lot of patients I am getting, Swarnamakshika Basma with the Amalaki Churna is the best medicine, and in a 60 to 70% of the cases it is working. But mixing together in front of a patient, it takes time, and moreover, some people will see us in a suspicious angle. Oh, something he is mixing together. So that is why nowadays I avoid. Even it is good, even though it is a good practice and we are getting best result, when we are doing the best service also, people may think that something powder he is mixing. That is why I never prescribe. But then the question comes, Godanti Basma, Pravala Pisti, etc. I am prescribing with container, because they will know. If otherwise what happens, if I take Pravala Pisti and I am adding with the Avipatikara Churna, they may think that some white powder is mixing, because people are not educated well in my area. That is why better I will ask, because they know that Pravala Pisti in Ayurvedic medicine, Avipatikara Churna, I will ask, I will give. They will mix together and they will know that it is a pure Ayurvedic medicine.
What is your view on Samanya Vishesha Siddhanta in practice? Then Anupana for different Aushadas and Sevanakal also.
Yes, without Samanya Vishesha Siddhanta we can't read in Ayurveda. Vriddhi Samane Sarvesham Viparite Viparyeha. And that is why Dosha Bala Vriddhi, whenever is there, we need to the Dosha Bala Hani. For that Ayurvedic we are having Samanya Vishesha Siddhanta only. Even Dhatu Bala Vriddhi, for example, Mamsakshaya is there. If they are ready to take the meat, suitable meat can be prescribed. Otherwise I ask them to take wheat or black gram. I ask directly, you take more of the Udina dosa tekolli, the dosa made out of black gram, or a sabudana. All these are having as a Brahman action. So if a patient is always drowsy, sleepy, heaviness, then I ask them to shift to the Lagu Ahara. So parched rice, green gram, all these are choices. That is how, very simply, because we need to simplify Ayurveda. We should not make the Ayurveda a complex. We know that Ayurveda system is very complex, but when we are catering it to the public, it should be as simple as possible. By that they will be moving towards Ayurveda. Otherwise nothing can be understood about Ayurveda. That is very easy. For example, another example I will give you. Coming with the complaint of constipation. Patient, doctor, now it is a season of rambutan. They are telling, can I take the rambutan? If we take 3 to 4 rambutan, the constipation will be worsened, and next day he will be coming with the complaint of hemorrhoids. Because we think that rambutan is so fleshy, it is having snigdha guna. Even though it is snigdha guna, it absorbs water content from the body, it is acting as a grahi. Or Amalaki Churna, it is a fashion now everywhere, taking Amalaki Churna every day for the well-being. But Amalaki Churna, it is predominant with the Kashaya Rasa. That is why regular intake of half spoon or 1 spoon of Amalaki for a prolonged period, instead of doing good, it is causing constipation. This is how we should educate our concept of Shunti and Ardraka. With us, we have to educate, they will be very happy. And if a patient is coming with the complaint of gastritis, GERD, gastroesophageal reflux disease, often they are having the habit of taking the junk food, which are usually pitta vata predominant conditions, or they will be taking charmuri in our area. That itself, the charmuri it is vata, it is worsening vata. Next day it will be increased. Then what I have to do? You take beaten rice, you add water, so with water you take it. It is having a snigdha ahara. That is how the viparita viparyeha is taught. Then second thing is regarding Anupana you have asked. Yes, in the majority of the cases, whatever the medicine I am giving, that itself is Anupana. For example, I prescribe Dhanvantravati with the Jira Karishta. So Jira Karishta 20 ml. Here one thing very important. I prescribe the medicine in its full dose. Because probably not an Ayurvedic, with the background of my Rasashastra and Vaisheshika Kalpana, it makes me to prescribe the medicine in the full dose. Full doesn't mean that 1 pala, 1 karsha, rasayana, etc. But for example, Dhanvantri Vati, if at all I am prescribing, I never prescribe Dhanvantri Vati 1 tablet or 2 tablet. Yes, for kids I refer 2 tablets or sometimes 1 tablet. But Dhanvantri Vati, whichever may be the company, I prescribe minimum 6 tablets. 6 tablets noon, 6 tablets morning, 6 tablets night. Even Arogyavardhini for skin disease, a Sravi skin disease, if they are coming, my prescription will be minimum 3 Arogyavardhini morning, noon and night. The question comes here. Sometimes they will be asked, doctor, single medicine 3 times to keep them happy. That is what I told. One Arogyavardhini of one company, another Arogyavardhini of another company I will give, so that they will be, a doctor has given 3 to 4 medicines. But otherwise my prescription will be same. With different Anupana, surely. That is why for the young people or young physicians or as well as interns, There is a book by name Sanjeevani Samrajya. Only one medicine, Sanjeevani Vati, how it can be prescribed in different conditions, more than 500, 600 conditions, it is explained. Or B.V. Gokhale, Bhaskara Vinayaka Gokhale has written another book by name Chikitsa Pradipa. In that also it is written, single medicines or simple medicines, when it is given with different anupana, simple anupana water, cold water is having different action, warm water different action, warm water added with shunti churna different action, warm water added with cumin seeds, it is showing simple action. That is why how kitchen remedies can also be incorporated along with the Ayurveda in the form of anupana. More than the medicine, sometimes these kitchen remedies are acting, but as we are prescribing, it is having more validity and they will obey strictly.
So we'll move into the challenges part of his journey. What are the biggest challenges did you face being an Ayurvedic practitioner till today?
That is why every day is a challenge in a clinical practice, because when patients are approaching towards us, they will be having highest faith with us, and as I am practicing since 25 years, patients think that he is an expert of Ayurveda and he can treat every disease or his suffering. That is why even if I am not in a position to treat that case, they are not ready to accept. Means you have to treat me. Sir, whatever the medicine, sir, ನೀವು ಔಷಧ ಆದರೂ ಕೊಡಿ, ವಿಷ ಆದರೂ ಕೊಡಿ, ನನ್ನ ಕಾಯಿಲೆ ನೀವೇ ಕಡಿಮೆ ಮಾಡಬೇಕು. This is very difficult, because when we know that I am helpless, my system can't contribute much, convincing them is very difficult. And because of the compulsion, if we are giving the medicine, once again told, our name is lost, our science credibility is also lost. Second thing is, if we are understanding the pathophysiology, it is a very important thing. If we are having 100 diseases or 100 people are approaching any hospital or a clinician, among them 30 diseases doesn't need any medicine. Among the 100 cases and 100 patients to whom we say that they are the patients, for 30 patients they doesn't need any kind of medicine. They need some suggestion related to lifestyle changes, etc. That is very important. Then let us say, then another 70 cases are there. Out of 100, 70 cases are there. For those 70 cases, Ayurveda is not having medicine, or it is very difficult to treat by an Ayurvedic clinician. Our filtration now only another 50 cases, but we can treat. Among them 50 cases, some medicines are not available, patients are not affordable. Very costly medicines are there. So in our rural area, they will be coming with 200, 300 rupees. And medicines are very costly. For a week's medicine, prescribing 1,000, 1,500 rupees long list, it is not going to happen. Better to take some other system of medicine. And another 30 cases, we don't know how much confident we are among those 30 patients. Ultimately, that is why among them 20 maybe we are treating knowingly or unknowingly, and out of that 20 to 25, 15 to 20 patients are getting good relief. Now we have to think, what is the contribution of a doctor in healing? That is why Prayatnasya Prabhu Vaidyaha, Na Vaidyaha Prabhu Ayushaha. Doctor can give the best service. He can be his best service, best assurance, best guidance, best healthcare service. But we can't assure that I will cure this disease. I will surely take care of this complaint, take care of this patient. We can't say. That is my personal belief. That is why we should not give false assurance. Acharyas have told, a person who is giving false assurance and taking money is equal to a chandala. That is the concept what I practice. Okay.
How do you address the issues like patient compliance and misconceptions and lack of awareness in the practice?
First of all, I see whether they are having faith towards the Ayurvedic medicines and myself, a clinician. Then only I treat the case. If I come to know that they are not having faith with the Ayurveda, and if they are not having faith with me, many times they are asking, Doctor, have you treated this case? What percentage of relief you have got? All these questions. But in my 25 years, I never printed a pamphlet also. I never, even my clinical inauguration, from the day, I never printed a pamphlet and distributed. Whoever is coming to my clinic, by the mouth, they know and they come. That is why, first of all, we should not give any false assurance. Second thing is, we should try hard to convince what is their problem, how they got it, and what is the remedy, how long this will be persisting, how long this medicine must be practiced, and if we are giving a practical guideline, a blueprint of the treatment, that will be very, very happy. For example, if whenever I am prescribing Chandra Prabhavati, I will tell, for another 3 days you will be passing a black colored stool. They are finding it, they will be very, doctor has prescribed. So after now probably your fecal matter is sinking, after 6 to 7 days when this churna completes, by that time it will be floating. That is Niramatva, because they are not the Niramatva, but I know when the Niramat stage can be attained, when Sravi, when Asravi, all these things, if we educate them, it will be very difficult. But educating every patient is not easy, and it is not possible to treat every case and every disease. So we should remain humble that I have studied only this much, or else I know only this much, or even though you have studied, you are having at most faith with the Ayurveda, we should have equal respect towards other systems of medicine. That is why the other systems are also we should know regarding that, because some upper hands will be there in case of surgery, in case of some neurological problems, etc., can be treated successfully in other systems of medicine. That is why without any second thought, without any dilemma, we should refer the case. So if we are successful in that, and it is our upper hand, and whenever we are referring some case, if we know the physician, better to inform those clinicians, so that our rapport will remain, and they will be having the faith with our systems also, because so many of my patients, pediatricians' sons are my patients, the gynecologist's wife is my patient. That is why, because it depends upon whether they are having faith with Ayurveda or Ayurvedic physician. That is the matter. Once, if we know that it is very difficult to convince about Ayurvedic medicine system, patyas, etc., prescribing the medicine will be waste. Better to refer to somebody else, maybe Ayurveda system or some other system of medicine. Because ultimately we should not play with the life of a patient, and we should not harm the beliefs of the other people.
And about research, what challenges do you see in terms of research and standardization, and also acceptance of Ayurveda in mainstream healthcare?
Initially, I am highly thankful to Alva's Ayurveda Medical College, because I served as a research teacher for a prolonged period, because as MD, PhD, everything is there in our specialty. It makes me to compel and work for a research. But everywhere, problem is monkey imitation. We call aping is more. The research methodologies, what we are adopting is to satisfy the modern people or modern world. Ayurveda is nowhere contributed by the present day research model or research methodology. And when we say that Ayurveda is a holistic system, individualistic system of medicine, the universal system what is adopted is not suitable to Ayurveda. That is the biggest problem, because when we say that Parpataka is the best drug in the treatment of fever, in the treatment of skin disease, in the treatment of ulcer, in the treatment of Amlapitta, question comes, what is acting as an antacid, what is acting as antipyretic, what is acting as a immunomodulator? It is very difficult to answer with the available Ayurvedic literature. I am having the answer for all these 4 diseases in Ayurvedic perspective. I don't know which alkaloid is responsible. I don't know. That is very difficult, because studying the science in the available mode, that is the modern science. So we need to look into Ayurvedic perspective. That is the difficulty what I am feeling. And I universally say the research, the true purpose of research should be development of Ayurveda, upliftment of society. But today's research is having the sole intention of commercializing. Getting the monetary benefit is the sole intention of present day research. That is why the name of Ayurveda is taken for the purpose of research, but nothing is given, no benefit is given to the science. That is my personal cry.
Yes, sir. Even we feel the same. Next, future scope of Ayurveda. What is your vision for role of Ayurveda in the future of global healthcare?
Simple words. आयुर्वेदो शाश्वतो निर्दिश्यते अनादित्वात् स्वभाव संसिद्ध लक्षणत्वात् भाव स्वभाव नित्यत्वाच्च. Whoever may be trying to suppress Ayurveda, Ayurvedic practice, more benefit we are getting for Ayurveda, but only thing is never think of practicing allopathy in the name of Ayurveda. Practice pure Ayurveda, but have due collaboration with the other systems of medicine, homeopathy, naturopathy, allopathy, whatever it may be, and with that best thing can be achieved. But surely Ayurveda will be having greater demand. Only thing is we should be dedicated and we should study hard, and moreover we should have the ability to convince the modern world how Ayurvedic medicine is working or how Ayurvedic system is working. And mere keeping the name of Ayurveda and practicing allopathy will not serve for long. We will be behind the bar soon.
How do you see young practitioners, that is budding doctors as we are, contributing to the growth of Ayurveda?
He is thinking as a backdoor entry for Ayurveda, it is very bad. Whichever may be the system of medicine, we should be confident, we should have love, we should have the affection, and we should strive hard for the science and for the society. By that we will be reaching to the highest level.
If you could change one thing in the current practice of Ayurveda, Ayurvedic education system and practice system, what would it be?
A kid, what we say, it will not listen. What we do, that will adopt. I think with this you will find, because majority of the institutions should focus towards pure Ayurvedic approach inside and outside. With that, surely we will be reaching to the global level. Our standard, the quality of the academics teaching, quality of the institution, quality of the public awareness will be meaningful.
Speaker's note: practitioners' message or advice for upcoming Ayurvedic Vaidyas and young Vaidyas. Any final thoughts on holistic role of Ayurveda in society, sir?
See, Ayurveda is such a science which is having the history of minimum 2,500 or 3,000, even though we say that 5,000 years. So, which has never changed in this flow. No fundamental principles of Ayurveda, no fundamental principles of Kaya Chikitsa, no fundamental principles of Rashastra, Vaishajya, Dravya Guna is changed. In the flow of or attacked by various kings, kingdoms, dynasties, political influence, etc. That is why it is not possible to change this. No medicine was found with the hypersensitivity reactions, and only thing is we need to convince the modern world where we should go towards Ayurvedic practice, where we should approach for Ayurveda, also where we should not approach Ayurveda. That is very important, because when some other systems of medicines are upper hand, proven efficacy is there, infections etc. can be managed appropriately, then we need to educate them where we should not approach towards Ayurveda, because maybe Ayurveda may be having medicine, because Ayurveda is of 3,000, 5,000 years old. What practice was there about 2,000 years ago, what practice was 100 years ago, for that some alternate and better one is there. Maybe it may show some undesired effects or side effects. If it is acceptable, better to adopt it. We should not have a blind belief that for everything Ayurveda is answer. Ultimately, it will take away the faith with the Ayurveda, and personal loss will be there. Because if our life is saved, then only we can think of the side effects. Because side effects will be the next side effect, toxic effect, adverse reactions are the next things. Second thing is, every student should have the faith towards their own system, like how we are having a faith with our parents, father, mother, brother, sister, etc. Likewise, we should have at most faith with the science, and we should have a very good coordination with the fellows. Means in the Sadvadya Deshaha Pranatyaga Hetunam is told. So we should have a very good relation with the physicians of our own society, Ayurveda physicians, and we should appreciate the good things of other systems. That is why we should have a good rapport with the allopathy, homeopathy, Siddha, Unani, whatever the system. So we should have a very, very good approach, and that is why upgradation, that is very important. The day when you are starting with the clinic, moving as per the therapeutic index or listening only the words of medical representative should be stopped. Instead of that, we should peep into the depth each day, and very importantly, lastly I tell, Ayurveda, every system of physician is telling what you are doing. I am practicing. That is very important. We are practicing every day. That is why today if a patient comes today in the morning with a complaint of headache, diarrhea, fever, we should, you are giving some medicine by assessment, and you should think, you should revise in the evening. Oh, such a patient comes and these are the medicines I have prescribed. If it goes wrong, what I can do tomorrow? If it is specified, what better medicaments I can prescribe next time? What kind of modifications I can do myself? And a discussion. That is why CMEs should be made effective by discussing only the subject matters, and more than today CMEs are taking the choices of the tables only, not the subject discussion. That is why much emphasis should be given to these practical ideologies in these continuous medical educations. We need to participate in the active way.